Hi, everyone. Thank you for being here tonight. We're going to get started in just 1 minute. We just let everyone into the room. So give us 1 minute and we will get started with our meeting tonight. Okay. Hello, everybody. My name is Katie Arrington. I'm the Assistant Recovery Manager for Boulder County. I wanted to let everyone know this meeting is being live interpreted. Our presenters are going to speak slowly and clearly and have breaths between their sentences. And what we need you to do as meeting participants is on the bottom of the screen on the bar with all the options you have, we need you to choose your language as English or Spanish. The English channel will be closed captioned. The Spanish channel will not. And if you click on the Spanish channel, you will have the live interpretation in Spanish. Our agenda for the evening is between now and 6:45. We'll be focusing on debris and debris questions, primarily targeted at those with destroyed homes. We're going to have some time for questions and answers. Then around 6:45, we have a public health presentation and a presentation from United Policyholders with some follow-up questions and answers. Thank you so much for being here tonight, and we hope to answer as many questions as possible. Off to you, Gary.
Thanks, Katie. Welcome, everyone. My name is Gary Santoson. I'm the Disaster Recovery Manager for Boulder County. And I just want to first off, just let you know that I may look up a little beat up, but that's because I had some successful skin cancer surgery recently and I'm just recovering. So I just want you not to be too alarmed at my appearance. I could be a little off-putting, but I'm doing fine and I'm happy to be here. I want to just share some announcements and some updates before we jump into the actual meeting. First, I want to acknowledge that there are a number of representatives from elected officials joining us tonight, from Senator Bennett's office, Senator Hickenlooper, and Congressman Neguse, as well as State Senator Fenberg. We also have county commissioners here tonight, City of Louisville council members, and Town of Superior trustees. I want to welcome all of them. I want to also let you know, and you probably already heard, that the Disaster Assistance Center will be closing Saturday. It's been open for 3 weeks, which is a very normal time frame for those types of facilities. Please know that those services will not go away. They'll be available online. There's an application, financial application online that you can access, and there's still funds for people who were impacted by the fire. The other announcement I want to make is that on January 27th, 6 p.m., the group insurance program, the United Policyholders Insurance Group, will be having a workshop on Roadmap to Recovery. This group is a nonprofit consumer advocacy group that's worked in disasters all over the country. I've had the pleasure of working with them since 2010, and they can really make a difference in helping you navigate the complex insurance claims process. I urge you to come to that. All you have to do is go to our website, which is, I'll ask Katie to put it in the chat, boco.org/Marshall Fire. And on the right side, you can click on a link and sign up for that workshop. And also, we will be posting this workshop, the recording, as well there. So I just want to give a quick introduction to this meeting and set your expectations. We're not going to be able to answer every single question you have, unfortunately, just because of time constraints, but also because we don't know all the answers yet. This is a really complex operation and challenging, and we're learning as we go. We're learning from other communities. We're learning from what we've done before, but we don't have all those answers yet. So I know that could be frustrating, but just bear with us. We're really working hard behind the scenes, advocating for this program. And please know that when we do have more information, we will let you know and we will share that with you. It's really important for us to be transparent and open and honest with you. And we don't want to set false expectations and answers that aren't reality. So please know that. So the meeting tonight is really focused on the first part on debris removal, and primarily for homes that have been destroyed. The second part of the meeting will focus on public health issues related to moving back into your home. And we'll have a speaker from the public health director, as well as someone from the United Policyholders. Both sections will have ample time for questions and answers. We urge you to put them in the chat. And we have already received quite a few questions that we will also be asking the presenters. So with that, I will want us to start the presentations and invite Darla Arians from Boulder County to introduce herself and start her presentation. Thank you.
Thanks, Gary. Let me get my screen opened up here. Are you able to see that?
Yeah, it's we can see the other slides too. So can you put it in presentation mode, or maybe down at the down the bottom?
Is that better?
Yep,
Yep.
Darla, I can see it as a presentation now.
Thank you.
Okay, super, thank you. Good evening, my name is Darla Ahrens, and I am the Division Manager for Boulder County's Resource Conservation Division. And I'm also the Section Chief for Emergency Support Function 20, which is our debris management. And I'm helping to lead the charge for debris removal for the Marshall Fire. And when I was at the community meeting last night, I just found it really helpful and interesting that Gary invited some of the former fire survivors to speak about their experience and talk about expectations and timelines. And so I thought it might be also helpful for tonight's meeting to talk about some of the prior disasters that I have helped to coordinate debris removal for Boulder County. So at the 4 Mile Fire cleanup, this happened in 2010. We had the cleanup completed for that disaster in 14 months. It was a little bit different than the Marshall Fire in that it was not a FEMA declared disaster. We didn't have a centralized contractor that we worked with. In fact, we worked primarily with the Southern Baptist Volunteer Group. The county provided household hazardous waste collections, roll-offs, hauling, asbestos inspections, all on our own. And I wanted to put this picture here in the middle so you can see, you'll hear a lot of talk about lined roll-offs and sealed roll-offs. And so that middle picture there is an example of what we mean when we say that this debris has to be in a lined roll-off and then sealed before it can be hauled. Then we had the 2013 flood, and that was a very complicated cleanup effort that had several different facets to it. In fact, the amount of debris generated in that disaster was about 10 times as much as what's in this disaster. And it took about 3 years for us to complete that cleanup, but it involved high hazard homes that were hanging over waterways. That involved a multi-agency interaction and lots of different facets of that cleanup, a lot of mud, rocks, silt, and vegetative debris cleanup, as you can imagine. So it's quite a different scenario, but that one took us 3 years to get cleaned up. Then in 2016, you see a little consistency here. Every 3 years, we seem to be faced with these challenges. So 2016 was the Cold Springs fire. We had all those sites cleaned up in 1 month. Again, it was not a FEMA declared disaster. There were fewer properties. Again, we worked with the Southern Baptists and we provided HHW, portalets, water, potable and non-potable water, hauling and inspections on that cleanup effort as well. And you can see on the bottom photo there, that is separated scrap metal, which we find a lot of in these fires. And we do follow our own zero waste principles as we're conducting these cleanups. So all the materials that are able to be diverted from the landfill, such as concrete and metal, the most obvious, and vegetative debris, they all will be handled separately and segregated and get recycled and composted. So moving into this cleanup effort, our phase 1 was our community roll-offs for areas that had been evacuated and were without power, and also who were impacted from frozen pipes and broken windows, had water damage, goods. That phase has already come to a complete. We are in phase 2. And the vehicle removal out of the right-of-way was the first part of phase 2A. That was completed as of today. And we're moving into the second part of 2A, which is the rest of the right-of-way removal. So all the hazard trees and limbs and fences that have fallen down, light posts, anything that's in the public right-of-way that could be impeding traffic for pedestrians or vehicles is what we're removing now. And we're doing all this work in our 2A phase so that we can clear the way for the next phase of our program, which includes a curbside collection as well as the private property debris removal. So then after we go through phase 3, then we get to what I heard last night is the fun part, the rebuilding and the design. I wanted to make sure you know that we publicly share all of our debris removal work. It's almost in real time. It's updated a couple times a day, and it's a color-coded system. I put the link at the bottom of this page, and when Gary or Katie sends out the presentation, you'll be able to click that link at the bottom, and it will take you straight to the page. The color-coded system will show you the work that has already been done for this phase. It'll show you what's happening right now. It'll show you what's coming up next. And then it'll show you the work that's pending, still being planned. So since we just finished the vehicle removal, I just actually took the screen clipping out of our page about an hour ago. And so our contractor is working on those hazard trees and limbs and vegetative debris. So that's what you'll see on the page if you look at it today. I also want to make sure you know that we have an FAQ page. Again, I put the link at the bottom of this page. Make sure when you click on this link, if you are one of those folks like me that will keep tabs open for more than a day in a row, make sure you refresh that page because as Gary mentioned, things change daily, and we're doing our best to provide you with the most updated information, and sometimes that changes. So please, when you go to our FAQ page, click the refresh button to get the most current information. Timing. I wanted to move into some of the more frequently asked questions that our team has been getting. So we talked about phase 1 that was complete as of January 15th. And then phase 2A, which is the right-of-way work, is happening now and expected to last through January 29th. That does include the curbside, excuse me, the curbside program for the smoke and wind damaged properties. So we need to allow some time for that work to happen. Then we will move into, well, that is phase 2B, excuse me, is the curbside. So that's January 30th through February 14th. So while we're doing the 2A right-of-way work, we'll allow the property owners with wind and smoke damage to prepare to move their items out to the curb for that phase 2B. And then the phase 3, which I know a lot of you are interested in, is our private property debris removal. And we are anticipating to begin that work in February after the phase 2B is done. I've also received some questions about how are you going to prioritize your debris removal work? And we have several factors in our consideration and our prioritization, one of which is environmental justice. And so the EPA created an environmental justice screening tool. You can see a little screenshot of it here. It has environmental indicators, demographic indicators, environmental justice indexes, along with variables. So we ran tables of data, including all the variables and all the categories. We then matched it up with census blocks. And so we used all the criteria and then compared it with our debris mapping online and combined the maps so that we could see the areas that had the most high hazards, had the most debris impacts, and weigh that out with the environmental justice and demographic criteria to come up with a prioritized list for our contractor. All right, another popular question we get, will foundations be included? So we are asking for FEMA to include foundation removal as part of our phase 3 work. We don't have that determination back from them yet. It will likely be a few weeks before we get that determination back. But based on the damage assessments conducted by the local building officials, we are told that most of these foundations are not going to be reusable due to the high intensity heat of the fire. They're just, the foundations are just crumbling. If you're in a situation where maybe you were on the outskirts or you have your own structural engineer, your insurance company maybe sent somebody out and has a different determination, please talk to us. And we definitely will consider that and want to make sure that any foundation that's reusable is preserved for you. All right, this is a good one that we've been getting. What's included in the coordinated debris removal program? You can see by this slide, it's a lot. It's all your necessary permits. It's air monitoring, not only personal air monitoring for the workers at the site, but also community monitoring in the streets and around the areas that are being cleaned up. There's traffic control, there's dust control. There's spill control measures, reporting and cleanup requirements. There's stormwater and erosion best management practices in place at every site before cleanup work begins. There's notification of the work, not only through our public facing map, but also through direct communication with you, the property owner, and the neighborhoods that are in the area where the work is happening. All the equipment needed to provide the cleanup at the sites is provided. The debris removal crews and all the ancillary crews for the testing are also included. An independent property assessment is provided property damage liability is with the contractor. There's certified asbestos crews. There's proper handling and separation of the waste streams from trained professionals. There's third-party monitor of all the work completed that is outside of our contractor. There's a certified arborist to make sure that any tree that is removed is in fact a hazard tree and deemed to not to either already be dead or to not be living in 5 years. There's a capping of all your utilities, and then there's a closure plan sign off again by that third party. So it's quite a bit included in the coordinated debris removal program. All right, I wanted to try to keep my presentation relatively short because I had just received some of the advanced questions that you had sent in, and there were quite a few. So I thought I should just cut it off there and turn over to answer some of the questions. So Katie, I don't know if you have those or if you want me to pull some of them up myself.
No, I'll help so that you can just focus on the answers, and I'll throw the questions your way. And questions that are coming in the chat are going to be chatted to me, so you don't need to worry about that either, Darla.
Okay.
So a main question that we have in the chat and that we got in advance is who is paying for it, and an explanation of how it works if insurance is giving some of the money and not all of it, or if insurance is not covering all of it. So really some details about the financial aspects of this program.
Yeah, thank you. That is a popular question. And what I can say is again, we're waiting for final approval from FEMA on our debris removal program. And again, we have requested that FEMA approve a program that's similar to the programs we've used in previous disasters, where if there is an outstanding cost for an individual property, that cost gets applied to the overall project cost and not be billed back to a property owner. That's just how we've done it in the past. So that's what we have requested. And then the county would be responsible to cover the local government cost share of the program, where FEMA public assistance would cover, it's typically 75% of the cost. So then the county, Superior Louisville would respectively have their cost share against that 75% or whichever percent FEMA determines. So as soon as we have our determination, we'll be able to give more specifics on that.
So a follow-up question, and you may not have the answer, and that's okay. If insurance covers part of it, and we have residents nervous about getting a bill back for an unexpected amount, is there a potential that that happens, or what do you know about that?
I think that's a good question for the insurance segment later. I can again only speak to our past experience where the county hasn't ever billed a property owner back for any extra costs.
Great. Thanks, Darla. So we have some specific questions about what will and will not be removed with debris removal. So I'm going to ask you them in kind of one lump sum. Will driveways be removed? Will landscaping be removed? And will cars be removed?
Okay, so driveways are included under the foundations and slab category that we have requested, but we again are waiting for FEMA determination. Landscaping, so any landscaping that is charred, destroyed, will be removed. If it's deemed dead or not going to live, it will be removed. Any landscaping that is not damaged will be preserved. We want to preserve as much of the landscape as possible. And vehicles, property owners, vehicle owners need to call their insurance company and get their insurance agent out there to inspect their vehicle and work with their insurance company to get their vehicle towed. And I'll let the insurance experts answer that question in more detail, because there are specifics about what kind of coverage you have and whether your insurance company will be able to tow that. And just as an example, if you don't have any car insurance on your vehicle, that's something that we are trying to figure out still. So we hope to have more information for you and hope to be able to help you with this.
Thanks, Darla. What is the debris removal FEMA eligibility? What does it look like for condos and condo associations?
Yes, so condos are under the commercial property category, and those are not automatically included in our private property debris removal program. I would encourage anyone in a condo situation to talk to their property owner, or if they own the property, then talk to FEMA about what individual assistance would be available to you as a condo owner or renter.
Okay. This is a 3-part kind of similar question. How will intact homes be protected during the debris removal process? What effect will cleanup have on intact structures and homes? And how are you ensuring that cleanup is not causing other homes to have to redo their cleaning services that they already did or will do in the coming months?
Yep, that's a good question. So I want you to rest assured that all measures are being taken to protect the environment around the work sites. This includes air quality, water quality, stormwater quality, as well as personal safety through traffic control. The health and safety of residents that are within and near the impacted areas are a top priority for Boulder County. And our program is intended to remove disaster-caused public health and safety hazards within the burn area. So where homes are still standing and where residents still live, we understand that. So in performing this work, the county will work with our contractor to minimize any secondary impacts to the residents and standing structures that are nearby. To aid in this, we will be providing advanced notification to neighborhoods where work is commencing so that residents can respond accordingly. Like I said, all measures are being taken to reduce impact, including low impact machinery being used so that adjacent homes will have the least impact as possible. Did I answer all the parts of the question? I think I did.
I think you did too. Can you explain or help us visualize what a cleaned up, debris removed lot looks like? How is it left for residents? What does the soil look like?
Yeah. So when the property is cleaned, the soil will be scraped anywhere from 2 to 6 inches. That soil will be tested and the utilities will be capped. The stormwater and erosion control measures will be left in place. And once the site is officially closed, then it gets turned back over to the property owner to manage the stormwater from there on. And then you get to work with the building officials to start your rebuilding process.
What do you think is the extent of the timeline for phase 3?
That's the $1 million question. We will be able to provide a more concrete answer to that in mid-February. Based on my experience, each individual property takes about 3 to 4 days to clean up. And I can say that we plan to work with more than one contractor for this cleanup in order to expedite it as quickly as possible. And I am excited to get more information developed to share with you about that as soon as possible.
Can you speak to the indemnification clause in the ROE contract? Does it mean we're liable if personal injury occurs on our property during debris removal?
Okay, I was happy to get this one in advance so I could ask our county attorneys. And so I will read their response because I am not an attorney. The indemnification and hold harmless clause is necessary for Boulder County and its government partners to provide assistance to property owners on their private property. The county requires such assurances for legal, insurance, and funding purposes. Property owners that choose not to agree to this language are not required to and can choose to remediate their property on their own. I hope that's helpful.
Thanks, Darla. And so many of these questions are so tricky and do involve legal advice. And that's part of why we some of the questions we may not be answering right now because we need the legal advice. So we're going to work on, like Gary said, we're not going to have all the answers tonight, and we're working really hard to get all the answers. Oh, I had a question.
I have one, Katie. Can I jump in?
Yes.
Yeah, so two questions I'm noticing. Can people opt out anytime before their property is the debris is removed from their property, and how do they do that?
Residents can opt out until the right of entry deadline. It's currently January 26th. I will say that we have a new extension that is likely going to be granted that more aligns with our planning efforts. And so since our planning efforts have been extended about another week, it's likely that we are going to extend that rate of entry out until February 1st.
So, okay, so also there's some folks that have experienced what the damage assessment team has labeled partial damage, but it's so significant, there's a great deal that needs to be removed. Are those folks eligible for the debris removal program?
From our damage assessments data, we show about 20 of those homes that fall under FEMA standards, where if there are 2 or more contiguous walls, FEMA deems them damaged and not destroyed. And our building officials have a different opinion that they in fact are destroyed because they're hollow inside and basically have this facade of walls, and that's all that's standing. So we included a request in our FEMA package to have those properties included. And so when we receive our determination letter, we'll be able to give you a better answer, but we sure hope they are included.
Okay, thanks. Last one for me. Can you speak to the indemnification and liability clause in the ROE contract? Does it mean we are liable if personal injury occurs on our property during debris removal, and just the generally onerous language that's included in the right of entry?
Mm-hmm. I actually just answered that for Katie. I'm happy to repeat the answer if you want me to.
No, it's all right. Sorry.
Okay.
I was too busy looking at the questions.
I
Go ahead.
figured it's
Thanks.
okay.
So I think we need to do one more explanation of the costs, because we're still getting a lot of questions about the cost.
Okay.
And people nervous about opting in for the costs. So let me give you an example to see if we can walk it through. If someone's insurance company is giving them $5,000 for debris removal, how does that work for that specific owner to be a part of this process?
Mhm. This is really an insurance question. I can speak again to prior experience, but I don't know if that's what I should do. I
Why
think,
don't you explain the prior experience process again, so that we just have it again for the audience members?
okay, so again, I'm sure you've all learned, each insurance policy is so unique with what coverage they have. And even if you have $5,000 of debris removal coverage, depending on how your policy is written, your insurance company could require you to take from other parts of your policy. So I will let them go into that. But for a simple example, if you had just a really straightforward policy where you only had $5,000 of debris removal coverage, and it costs us $10,000 to clean up your property, then we would settle up with your insurance company. Boulder County would collect the $5,000, put it towards the overall project cost for the whole coordinated debris removal effort. And then that $5,000 that goes towards the project cost is where that 75% FEMA share comes in, or whatever percentage they determine. So if FEMA says 75%, and then the state could have a share of that, the county could have a share of that, and if you're in Louisville or Superior, they could have a share of that. I think that's the most simple answer. In our past experience, like I said, we have not ever billed a property owner back for that overage.
And just to clarify again, a residence can opt out until the deadline, which is currently on the 26th of January, but may be extended.
That is correct.
Okay.
And on that note, anybody who has not submitted a right of entry form yet was contacted today. There is other stormwater protection work that our stormwater folks would like to complete, and they need your right of entry form completed. There is an option on there if you haven't made up your mind yet about whether you want to participate in the county or the coordinated debris removal or do your own. That's totally fine. You can just check the hydro mulching checkbox for now, and then still have additional time to make up your mind later about if you want to participate or not.
What, in your previous experiences, if someone opts into the program, what is their notification process for when the debris removal is going to happen? And can homeowners watch the debris removal of their property if they wanted to?
Absolutely, yes. So we will develop the DROP, which is the debris removal operations plan, as soon as our contractors have been selected and approved by the Boulder County Commissioners. That'll take some time to develop, a week, maybe 2 weeks. And once that DROP is developed, it will have the neighborhood, and we're going by census blocks in this case. So neighborhoods within the census blocks identified. An advance notice will go out. So for example, for right-of-way vehicle removal work that went out through press release, there was a direct email that was sent out. Our PIO messaged on all the next door neighborhoods where the work was being completed. And so there will be multiple avenues of notification happening. And for vehicle owners, again, they're getting a direct letter sent to them. So as much direct communication as we can achieve, we are, and as much advanced notification that we can provide, we are.
And this is a question you may not know the answer to, because it may depend on the jurisdiction. But in case you do know the answer, I'm going to ask. For those that hire private contractors, what do we know about how the county and cities will expedite the permitting process for them.
Yeah, I don't have that answer. Sorry, Kate.
Okay. No, that's fine. It's just I wanted to acknowledge that we got asked that a lot. So I just want to acknowledge there are going to be specific processes with permitting based on if you are in Superior or Louisville or unincorporated Boulder County.
Mhm.
That's going to be true for rebuilding as well.
Mhm.
So we will work on FAQ answers with those jurisdictions to try to get answers for each jurisdiction to help with that.
Mhm. Yeah. And I can't answer on the hall licensing side because our division does manage that piece, that we're processing those in real time. We've gotten over 20 in the last week that have been processed on the same day. So
we are almost out of time.
I have another question.
Great, Gary, I was about to ask.
Yeah, retaining walls, are they included?
retaining walls, that's a tricky question, Gary. Based on our damage assessment data, some retaining walls are okay and others are not. And so we're working with FEMA to review those and make a determination.
Okay, how about fencing?
It's similar if it's destroyed. Yeah, so a fencing that's destroyed, that's a hazard. So that's how FEMA looks at it, is if the fence could fall over and hurt somebody or fall over into a sidewalk, that's a threat and we need to get rid of it.
So one of the questions that comes up a lot is comparing, should I go do it myself and hire a contractor, or should I go through the coordinated program? And so can you maybe speak to what are the requirements for doing it on your own and help people? One of the questions is, does the contractor have to provide all of the monitoring and sign off, or is that the responsibility of the homeowner if you do it alone?
Well, if you choose to do your own work as the property owner, you are responsible for making sure that you follow all the guidance and rules and regulations of your jurisdiction. Your contractor will take on liability for the work that they're completing. And so it really depends on who you hire and what sort of team they bring to the table and what expertise that they bring. And in that situation, you oftentimes have to hire multiple contractors because a demo contractor usually isn't a certified asbestos abatement contractor, and who isn't a soil specialist, who isn't, the air quality specialist. So I think, to get back to your original question in terms of if there's any benefit, I think it's just knowing that everything from A to Z is being taken care of in the county program. And there's a list, it's on our FAQ page that has requirements on it. If you're doing the work yourself, we try to make it as transparent as we can for you. So check that out on the FAQ so you can make the best decision for yourself.
Okay, and I have one more. I think some of the concern is that the deadline to sign the right of entry to opt in is before FEMA even makes a determination about the program. So people, I think, are feeling concerned that how do we make an informed decision to opt in if we don't really know the full, whether or not the program's been approved or what form it might take. So is there consideration of delaying that opt-in until FEMA makes its decision?
Yeah, that was what I spoke to earlier, that we are considering and very likely will extend through February 1st.
And if FEMA does not respond by then, even extending it further?
Well, that's a tricky question, Gary. I can't really answer that
Okay.
right now. We have our own reasons for having that deadline to develop the scope of work for the contractors who are selected. And it's important for us to understand what that scope of work is so that we can create our prioritization list and get ready to be boots on the ground within 3 days of that contract being executed.
So Gary, I know we're gonna wrap up and move on to the next speaker. Darla, I wanted to let you know that there are some comments in the chat and the questions about people who have not yet signed the right of entry form and did not get a notification today. So I just wanted to let you know that there's a handful of people in the chat that are saying that, so we may need to look into that process.
Yeah, we will. Absolutely. Great. Thank you, Kate.
So I know that may leave more questions than answers. The debris team is working on the FAQ from the debris team is pretty much updated daily, if not more often than that. So keep coming back. If we need to have another debris town hall, we can look into that. Like Darla said, all of our previous experiences are much smaller. So we're having to scale up and answer our questions just as much as you have questions to answer. So thank you for your patience and grace in listening to our answers at this point. Back to you, Gary.
Yeah, I want to just echo that. Thank you very much. We've received, 330 questions in the chat. We have received about 60 questions in the last day or so. We will do our best to go through them and respond to them and add to the FAQ document that Darla referred to in the website, if they're not already covered there. So I'd urge you to go to that website. And as I said before, we're learning new information every day. So we will continue to update that website with the best and updated information as possible. So as I said, the next part of the meeting is really about how to understand the risks associated with returning to your home. So the folks who are on the call who've lost your homes, you don't need to stay for this portion if you don't want to. I probably urge you not to, just given my past experience. It's sometimes kind of hard and frustrating to hear about people's concerns who still have a home and you don't. So I want you to think about taking care of yourself. You can always come back and review the recording of this if there's something you want to learn more about. So with that, I want to introduce the Director of Public Health, Camille Rodriguez, and welcome her.
Thank you, Gary. Gary is going to help me by driving the PowerPoint. I want to take this opportunity to express my gratitude for being able to share tonight with you all what the role of Boulder County Public Health is in this response and recovery. And I might take that grace to go over those bits and pieces of our roles and responsibilities with you, so that I hope it sets the stage for why, as has been the theme of our evening here, we might not be able to answer all of your questions, but we will try. I want you to know that, as a part of Boulder County government, we are actually also a separate legal entity, and we receive our oversight from the Boulder County Board of Health. They are appointed by the Boulder County Commissioners. What I share with you tonight is really what our responsibilities were and continue to be in the response and recovery. We collaborate with the Boulder County Office of Emergency Management, with the Sheriff's Department, and with so many other colleagues within the county structure, but what I'll describe tonight to help set the stage of what our role is only about Boulder County Public Health. So in this particular event, as with many, we are trained as local public health officials to respond to many types of disasters. And in this case, we worked right along other first responders and other professionals at the time of the event to support evacuations, to provide shelters with masks and testing kits, because probably how you've gotten to know us over the last couple of years is because of the pandemic response. We worked initially and continue to work to support community members like yourself to obtain vital records that you may have lost in this disaster. We have been trying to share information relative to what our local, federal, and state partners do in a fire response, or with information about what to do in a fire, to direct you to appropriate resources. And again, we collaborate with the Colorado Department of Public Health and Environment, and with many other state and federal agencies. And our regular roles do include and will include in this response to monitor some of our health indicators, to mobilize community partnerships locally and at the state level, especially to address health issues that we are expected to see in the future relative to this response, and always to inform, educate, and empower our community to address the health issues. So, we've put all hands on deck inside this local health department of yours to work to try to address some of the initial questions and concerns. We've also reached out to other important collaborators that can assist us in gathering data. We're reaching out to a pulmonologist and their team, and also looking at syndromic surveillance data so that we can understand if community members have experienced any health effects. And that's why I say in this response and the recovery, which has felt a little bit simultaneous at times, we are working hard to try to answer your questions, your very valid questions about health concerns. We have standard operating duties that we perform as a local health department. We address family health, community health, communicable disease, and environmental health issues on a daily basis. And all of us have been participating in some capacity in the response and recovery. We do all of this work on both ends and during the pandemic to keep all of this going. And so we're especially grateful for all the collaboration that we've had with our partners, which is also a part of our statutory responsibility, especially in the areas of a fire response as they relate to air quality. Next slide, please. So right now, I want you to know that, as I mentioned, Boulder County Public Health, as a local health department, has a statutory responsibility regarding air quality to collaborate with our state partners, namely the Colorado Department of Public Health and Environment. We do that, and in addition, at our own initiative, installed particulate monitors in and around the burn area approximately 7 days after the fire. And we are working to install additional monitors so that we can provide you with the most up-to-date information on the data that comes out of that particulate monitoring. Really monitoring air quality, you should know, actually before the fire was one of our very small responsibilities. It is not a large part of our operations, and actually, if you're a person like me who observes getting a push from their weather application on their phone about air quality, those do not come from your local health department. We are responsible for monitoring air in and around the Boulder Reservoir, for example, but on a regular day, the monitoring of air quality is a function of ours, but not in an area as vast and extensive as the burn area post this very tragic fire. So I wanted to set that stage so that you knew that our work in strategically positioning additional air monitoring stations throughout the burn area and in surrounding communities does intend to track potentially harmful ultra small particles in the air. And in that, we will be reviewing the data on air quality. And as I mentioned, with respiratory illnesses at local hospitals through our syndromic surveillance data, to provide you with the most up-to-date data on our air quality throughout the community, but especially the burn area. Next slide, please. I wanted to give you a little bit of a picture of what we do and what we do not do, not because we don't want to, but because it is not necessarily a part of our current responsibilities as a local health department. As I mentioned, we do and will continue to install particulate monitors to measure the air quality. We always will be collaborating with local, state, and federal partners to continue with other efforts above and beyond that local data air quality monitoring. Again, I mentioned that we will inform and educate and recommend, especially when and if air quality is not of a standard that we feel is safe. And so I visited a school board meeting last week and addressed concerns about that parents had about sending their children to school in and around the burn area, and simply stated, I shared that if the readings from the particulate monitors would lead us to believe that any changes in being outside, going outside for recess, taking a walk outside would be of concern, that we would inform that school. And we are working to find ways to more systematically inform the community of the same as a result of our additional particulate monitor installation. The other thing we do always as well is inspect for septic installation. And so that could be a part of some of the questions I know that folks have had and that were submitted in advance. And I can go into that later. What we do not do, unfortunately, is regulate home or soil inspections or determine by a home visit or any kind of assessment in your home if your home is safe. And so that could be some of the questions that we continue to try to gather information on and answer, because it's a complex issue, of course, since that is not a part of our regular statutory responsibilities. Next slide, please. We've been providing general guidance to the community, and that does include, people with respiratory illnesses are advised to consult with their healthcare provider before entering a burn area. We want you to be aware that poor air quality can cause some of the same symptoms as COVID-19. So if you're feeling sick, talk to your healthcare provider and get tested for COVID-19 to perhaps rule that out. That's important to do. And then One thing we can recommend is that when you are back in your home, that you get your HVAC ducts professionally cleaned as soon as you can. Replace filters if they appear soiled. And these are just general considerations. I will add that every home in this situation is going to be different, have a different experience. And so I want to, let you know that these are general guidance areas for you and your family. Next slide, please. For the long term, I wouldn't be doing justice to the larger concerns of the trauma that our community and that perhaps you have experienced. I want us to know that we are still in a pandemic, and the numbers of cases of COVID-19, especially because of the Omicron variant, are sky high right now. And I appreciate the care and concern that our first responders and that our emergency operations staff gave to leaning on public health for testing kits and for KN95 masking for the shelters, and for you community members that visited the Disaster Assistance Center during this time, because this community certainly has been through so much, and to continue to work to prevent illness, severe illness and death relative to this pandemic is important, and even harder to do when one is responding to such a tragedy. I also want to acknowledge that traumatic events can trigger mental health and behavioral health needs. And I know that through our work at the Disaster Assistance Center, we've been sharing how you can get help in that regard. And certainly you can visit our websites to find more information about that. But I wanted to acknowledge that it's so important for you to get that help if you need it, because the stresses, the concerns that you are expressing tonight, and the stresses you are experiencing, likely as a result of this tragic event, especially as evidenced by the hundreds of questions that you are asking and that you need answers to, can truly make coping with this challenging. And so I'm urging you to take care of yourselves in that regard. The other issue that, perhaps I'll answer in some of the questions that you provided or that you are sharing in the chat is that, of course, any of the conditions relative to air quality and the efforts that Boulder County Public Health is making relative to measuring air quality can change. Right now, we are seeing wet soil and even a bit of snow and ice on top of the debris. And we know that our messages will likely change when our soils dry up, perhaps if we have wind events, and be rest assured that we are working hard to find all the ways that we can share that information with you, whether it's through social media, whether it's through putting up placards and signs in the burn areas, and even creating a YouTube video perhaps and showing you where some of our particulate monitors are located. I also urge you to go to a website called purpleair.com. If you have not been there, I urge you to go. It's very easy to use. When you arrive, you press a button and you can view a map of where the existing particulate monitors are in our county, and you can see real-time readings about their measurement of the air and its quality. And so with that said, that actually ends my presentation portion. Thank you for giving me the opportunity to share a bit about the roles and responsibilities of Boulder County Public Health And Katie or Gary, I'm at the ready to try to answer questions of our public about public health or air quality. Thank you.
Great, thanks, Camille. Let's have Carrie wait with the United Policyholders, give her presentation, and then after that, we'll go into the questions for both of you. So thank you, Carrie, for about 10 minutes or less. Please go for it.
I'll do my best. Thank you, Gary. And thank you, folks, for just taking the initiative to be present here and to glean all the information you can to help you in your recovery. I do not have a lot of answers around insurance and debris removal programs with FEMA because there are so many variables. I'm going to sound a bit like the rest of the speakers. Until the program is all settled and the agreement is set, there are some things we just won't know. And then the amount of debris removal available to each of you is going to be dependent on your specific policy and your specific circumstances. So hopefully a lot of that will be fleshed out in the not too distant future. And, you know, that will be something that you can get done and passed and on to other things. So I'm going to go ahead and start up here. Okay, can everyone see my screen?
Yes.
Thank you. Okay. So I'm Carrie, and I'm the Colorado coordinator for United Policyholders. And as Gary said, we have been working with the County of Boulder and Gary since the 4 Mile fire. And I am a standing home partial loss survivor from Waldo Canyon from 2012. And Gary was one of the first souls from another jurisdiction to reach out and offer assistance. And so I've been grateful for that ever since and along the way. And it is my pleasure to be able to do what I can to try to present this great information that the nonprofit United Policyholders brings to folks who are working to get their full recovery from an insured catastrophic loss. And to start with, we have quite a lot available to you in resources online. This is the Marshall Fire curated library landing page. The second line at the title here of this slide is the address online to the link to reach this page. You've probably seen it in multiple different locations, and we were present at the Disaster Assistance Center and have been, and we will remain present with Boulder County through this recovery. We are grateful to the Community Foundation of Boulder, who is helping fund us. Since we are a nonprofit, we do not take money from anyone other than individual donations and grants and that type of thing. So we are able to be independent and give you straight talk on how to recover your insurance funds. Lots of good resources online. I am going to show links as we go along at the bottom and along the way in the slides. And these slides will be available to you in PDF format. So I have more slides than I have time to review, but I recommend you download the PDF. It should be available. I think Gary said they were going to put it in the chat, and we will have it available on our website as well, so that you can use these reference slides going forward. So the primary issue that I wanted to make sure we addressed today are issues that we are hearing about where many people with damaged homes or standing homes that have been impacted by smoke and ash and possibly heat are being told by insurers that when the water and gas are back on, that the home is habitable and able to be moved back into. Also, many people are just so anxious to get home. So there is a rush to move back in. I moved back in as soon as I was allowed into my standing home. I just want to encourage you, if you are not living in that standing home, try not to move back in. If there is evidence of ash, soot, and smoke that's entered your home, even if you really aren't sure to what extent the damage is, we really encourage you to move with caution. As you heard from your public health folks, there are a lot of potential dangers and concerns. It is also can be much more difficult to get your insurance company to approve additional living expense to pay for you to live somewhere else while your home is tested and mitigated if you are already back in the home. Doesn't mean you shouldn't ask for that, and that does often get approved with the right backup and documentation. But move ahead with caution when going home. We have a number of documents that I'm going to provide you the links for that will help you step by step go through some of the choices you need to make. A lot of the residues that can harm your health or that will cause long-term issues in restoring a standing home after a wildfire are not easy to see with the naked eye. If there are members of your household who have chemical sensitivities, very young, very old, certain pets, people with a history of respiratory illness, or that are immunosuppressed, it is especially important for you to move with caution. Notify your insurer of your special circumstances and consult with a physician before moving back into that standing home. Some of those hazards that can't be seen with a naked eye don't always get raised immediately with the standard testing that your insurance adjuster might do or recommend. And that can require special testing, such as testing for VOCs. That's a term you're probably going to want to learn about, and I'll talk more about as we go. Any evidence of smoke or ash that's entered your home, I mean windowsills, through doorways, through the attic vents, anything like that is justifiable reason to want testing to ensure that your home is safe before you re-inhabit it. There doesn't have to be tons of black char or a partially burned room for that to apply. I want to break down a little bit the insurance speak on additional living expense and what trips your insurer to, in most policies, to pay for temporary living for a hotel room, a home. Perhaps you have a family member who is willing to take you in, but there are additional costs to them associated with that, and you'd like to make sure those costs get covered. You can document those costs, and additional living expenses can be reimbursed to you from your insurance company in many cases for that, especially when there is such a shortage of housing available. We have to be agile and creative sometimes, and the insurers are encouraged to do that. So when a loss insured from a covered peril, and in this case, it's fire, and smoke and fire are really the same peril. You know, one comes right along with the other. And so smoke is a direct result of fire. And most, if not all, homeowners policies in Colorado have fire and smoke as a covered loss. If that fire and smoke cause your residence, the covered residence, to become uninhabitable or unfit to live in, you're generally owed ALE, additional living expense, under most policies. That additional living expense has a time limit. It may be in a renter's policy 2 weeks. It may be in a homeowner's policy up to 24 months in Colorado. And under special circumstances, it may even be possible to extend that a bit further. Let's see, my toolbar is kind of in the way. Let me see if I can get that.
You can wrap up in 2 minutes, Gary, then we can get to
Okay.
the questions.
Okay. I want to talk a little bit about the tips for self-documenting the initial intrusion of smoke or ash and the need for ALE benefits. So you may need to send some documentation to your insurer or to ask your insurer to come out and inspect further or test so that they will approve that you can live in a safe environment while your home is evaluated and remediated. Take a close-up look and photos and videos of your windowsills. You can remove pictures and art from the walls and look at that from an angle. There will be a different sheen where residues from smoke have attached to the wall. You can, document that. You can go to sources like your public health department and the Purple Air and Google Earth that can help demonstrate where the smoke plume and particulates have been on the day of the fire and following that. And then you can take lots of pictures yourself of the debris and ash and the proximity to the burn of your home. I suggest you document. Your goals in a standing partial loss are generally going to be to restore your home to its pre-loss condition. Sometimes that means cleaning. Sometimes that means replacing things, repairing things. It may mean that your carpet and floors need to be replaced and refinished and the walls painted, insulation pulled out, and any number of other things. But the level of damage to your home is directly related to the amount of infestation and the amount of heat your home is experienced. So the initial testing is super important. And I encourage you to come to our website, sign up for the updates on our emails about our coming events, and Gary's put in the chat our first orientation event, which will be January 27th. Let's see, all of these slides will be available to you, and these are different links that get into detail about thermal damage and about smoke damage and how to document those things. Thank you.
Thanks so much, Gary. And I'm sorry, we just didn't have enough time to get to
No, I know it's a lot of information.
But yes, we will be listing these on the recovery website. If you could, also put those links in the chat. We'll now turn to some of the questions, Katie. And you can stop sharing.
Camille, and maybe Camille and Carrie could stay on video because I'm gonna punt questions both your ways, and we only have 9 minutes till the meeting's over, so it'll just be a couple. what do you know, Camille, what do you know about the long-term effects from the fire in the soil? How will this be measured and tracked? Will EPA be involved? And what does this look like in private spaces versus public spaces?
Thank you for that question, Katie. This is one of those areas where I'm going to ask for the community's grace so that Boulder County Public Health can do some research and connect with our partners. We are connecting with the EPA. We have connected regularly with the Colorado Department of Public Health and Environment, and especially with their state toxicologist and a full-on team of other staff. But because, as I mentioned earlier in my presentation, that Boulder County Public Health does not on a daily basis do soil inspections, we are definitely wanting to get those answers for the public, and we'll do the research. And our public information officer let me know that if it's good with you and Gary, Katie, we can compile a list of the unanswered questions and post them on our Boulder County Public Health website, or provide them to you and Gary so that you can post them as well in a place and space where all of our participants tonight can check on the follow-up I will give to their question on this one. But I don't have an answer tonight. I'm sorry.
That process would be really helpful, Camille. And yeah, so we just so all the residents know who are still on this call, the recording of the call will be up tomorrow sometime. It will probably take us about a week to get questions, a first version of questions answered, and then we'll roll out additional questions as we have them. Another question for you, Camille. We have a lot of comments in questions in the chat talking about nobody can find air quality by monitor on the CDPHE website within Boulder County. Can you help with this at all? Do you have any advice?
I know that when I met with our Division Director of Environmental Health at Boulder County Public Health, Joe Malinowski, he shared the Purple Air website. And I bring it up to the public to note that there's probably a few nuances and things that are not explained, but it is the best place at this point to go to. And I'll expound more in our FAQ about what our Colorado Department of Public Health and Environment staff are doing. I know just today, they posted an FAQ, for example, on indoor air quality, very general advice. I was pleased to see it. And we will continue to work with our partners there to provide you with more information. And it really is focusing on Boulder County, which I thought was very helpful. So I encourage you to go to the website and even Google indoor air quality CDPHE, and you should find that release today. And we'll put a link to it in our FAQ as well.
Thanks, Camille. And Carrie, I have a question. Couple questions for you. What, if any, recommendations does United Policyholders have for renters who might not have had renter's insurance?
If you don't have renter's insurance, then our suggestions would be that you connect as soon as possible with all the long-term recovery folks that you have there in your community and in Boulder County, including the Community Foundation of Boulder, and that you sign up for FEMA, since this is a FEMA declared disaster and there is individual assistance, you may well be able to get lots of help that way.
Thanks, Carrie. And then I have a multi-part question about ALE coverage.
Sure.
So how do I get my insurance company to cover more than a year of lodging in my destroyed home? Because it feels like it'll take more than a year. And how do I get them to extend it for cleanup when they're trying to get me to move home quicker than I want to in my damaged home?
So that's kind of a long and detailed answer, but it depends on the terms of your policy. If you have 1 year in your policy, then that is sort of the fixed limit. However, the Division of Insurance has issued some guidance in the way of a bulletin, which is like a suggestion, a strong suggestion to insurers that this disaster is going to take a long time to get things resolved. So there is hope that there could be extensions, and we don't get what we don't ask for. So I suggest, again, please attend our orientation on the 27th and go online, and we have lots of resources. Kind of search around. Our landing page is a step-by-step process that can help you work through finding answers to your questions.
Thanks, Carrie. Gary, should we pass it back to you, or if you have any questions and or wrap up?
Sure. No, I want to thank Camille and Carrie for your time and sharing these resources and being willing to take a look at these questions that we couldn't answer today and post them on the website. As I said in the beginning, we weren't going to be able to answer every single question. There's still information that we don't know yet, especially whether or not the FEMA private property debris removal program will be approved and in what form that will look like. We will continue to offer these town halls and post information on the website, which is boco.org/marshallfire. It's in the chat. That's where you can go find the presentations, where you can find the recording of this meeting and the FAQ, frequently asked question documents. So I just again want to just thank you all for coming out. I know this is hard, it's challenging. There are a lot of unknowns still. It's going to take a good amount of time, as Darla presented, from past disasters. So remember to take care of yourself and your family. That's job number one, is make sure that you all are healthy and can continue to work on this recovery for the long haul. We are not going anywhere. The county, the cities, in the town, we're not going anywhere. Our staff are committed to working with you and standing side by side with you to figure out how to help you with this recovery. So with that, I want to thank all the presenters, with Darla, Camille, and Carrie, and Katie. I want to thank the interpreters, and thank you all, and we'll stay in touch. Have a good evening.